Hi, everyone. Thanks for attending. My name is Earl Matherin. I am the Funds Administrator for Local 338 RWDSU UFCW affiliated funds. The affiliated funds consist of 5 funds that provide benefits to our members. Local 338 has been around since 1925, and it has always tried to take care of its members. Besides the contracts and the benefits we provide, we wanted to start having these webinars to provide information and resources so that our members who are considering retirement or about to retire have the information they need to prepare themselves. If anyone has questions regarding any of the Local 338 benefits, such as health, hospital, medical, retirement, and annuity, please call our office from Monday to Friday, 8 o'clock to 4:30 at 516-294-1338. We have asked Barry Klitsberg to be our speaker from the Senior Health Insurance Information Program, SHIIP for short. He will cover several topics related to the medical enrollment program, including who's eligible for Medicare, how supplemental insurance works, Medicare prescription insurance, and a number of other topics that are the reasons why you're on this call. Barry Klitsberg is the Assistant Program Coordinator for the Nassau County Health Insurance Information Counseling and Assistance Program, HICAP for short, since 2017. It's a government-funded program designed to educate Medicare beneficiaries about their health insurance choices. There is no fee for the program services. They are not affiliated with any insurance company, agents, or brokers. Barry has worked with seniors since 1974, first as a Social Security Service representative, then as a health insurance specialist at the Federal Centers for Medicare and Medicare Services. And now he's finishing his federal career at the U.S. Administration on Aging as an Aging Services Program Specialist. We thank Barry for joining us tonight. Please hold all your questions to the end because we hope Barry will have answered most of them during his presentation. If you wish, you can type your questions or comments in the chat and we will address them at the end. Thank you everyone for attending. Barry, I'll pass it off to you. Thank you.
Good afternoon. Thank you all for attending. I do want to go over a couple of things. Like it was mentioned, I am a Medicare counselor with the Nassau HICAP program. We do not work with insurance companies, agents, or brokers, so we have no affiliation. Our program mission is to make sure that seniors or people who are going to be seniors have the information they need in order to make informed choices about their health benefits and retirement. So I want to just get that off the table. We'll have questions and answers afterwards, but I do think I'm going to answer a lot of them. But if we need clarification, that's fine. I'm happy to do that. Now, in the chat, I put our phone number, the HICAP counseling service number. Our hotline for Nassau is listed there. If you happen to be in New York City, you can call the New York City version of HICAP. Same thing. Usually you just leave a message with their number and they will call you back. In our office, we still have people that come into the office. So you may get somebody live or just leave a message. We will call you back, usually within 2 days. But I have a whopping case of OCD, and I try to get people the same day they call, if at all possible. But we will take whatever time you need to go over your specific issues. One of the reasons I ask for people to hold off their questions also is a lot of times people have questions that are specific to them, what I call I or me questions. If you don't want to divulge your information to a bunch of people who you may or may not know, you would want to call us and go over your specific. One other thing, a lot of people ask me, and this is probably the most common question I get, what is the best Medicare plan? And my answer is, what is the best flavor ice cream? It's what works for you. That's why we can go over all of the different plans, find out your financial and healthcare needs, and help guide you to a plan that would work best for you. Now, Medicare is a federal health plan health program for people who are either 65 or are getting Social Security disability benefits for 2 years. You can also get Medicare if you have what's called end-stage renal disease, which is permanent kidney failure requiring dialysis or a transplant. You get Medicare after 3 months after your diagnosis, and you can also get Medicare immediately, actually the first day of the month after your diagnosis of Lou Gehrig disease, ALS. Those are the 4 ways for people to get Medicare. All applications for Medicare go through the Social Security Administration. If you're turning 65 in a few months, you would call them. Usually you'd make an appointment to either come down to your local office or to do this by phone, or you can go online and set up an account at Social Security to apply for Medicare online. If you are already collecting Social Security benefits prior to age 65, your Medicare card will come in the mail automatically because Social Security knows how old you are if you're getting checks, or if you're getting disability, they know how long you've been getting these benefits. So 65 or disabled, kidney failure, or Lou Gehrig disease. That's how you are entitled to Medicare. Okay. Now, if you are working and covered by an employer or union health plan, and there are more than 20 employees at the company, which I suspect everybody here has, or 20 people who are in the union, which again, just based on the numbers of people who are on the call, again, more than 20. If you're working and have that employer group health plan, Medicare is your secondary insurance. Your employer plan is primary. So a lot of people don't apply for Medicare, especially the Medicare Part B, which has a premium, because they're not going to use it. And that's okay. If you are working and covered by a plan, you can put off Part B until you retire or the plan ends, whichever comes first, without a late enrollment penalty for not signing up for Medicare Part B. Let me repeat that. Medicare is secondary if you're working, or if your spouse is working, the same rule, and you're covered by your spouse. You don't have to take Part B. You can delay that until you retire or your health plan ends, whichever comes first. And then you can pick up Part B, which has a premium of $164.90 a month. Now, it changes every year. We don't know next year's figures yet. That's not released until the fall. But you can hold off on Part B if you're still working and you want to keep your employer coverage. Now, there's an 8-month period to apply for Part B called the special enrollment period. So when your coverage ends or the employment ends, you have 8 months to apply, again, through Social Security, for Medicare Part B without a penalty. If you don't sign up when you're eligible or after your employment ends, there's a 10% penalty for late enrollment for every full year past your entitlement date that's added to your premium. So if the premium is $165, I'm going to round the numbers up, right? And you wait 5 years because you just didn't apply or never got around to it, but you stopped working. If you wait 5 years, you would have a 50% penalty. So you'd have about an $82 a month penalty on top of your monthly premium. So that's why I always tell people, when you're eligible for Medicare, apply, or when your coverage ends from your employer or the employment ends, apply then. A lot of people tell me they don't take their Medicare or even their prescription benefits because they're healthy. They don't go to the doctor, they don't take drugs, They want to apply when they need it. And my answer to that is, do you have fire insurance on your house? And everybody says, oh, of course. And I ask, is your house currently on fire? And then they get it. It's insurance. It protects you if you have a medical situation where you need care, either an acute situation or a chronic condition, which something like high blood pressure could turn into an acute emergency at some point. So you want to make sure you have your Medicare lined up when you are ready. Again, 65, we're disabled for 2 years, right? A lot of people don't apply because they want to hold off on their Social Security until they're 66 and 6 months, or even 70 to get a higher benefit, which is fine. You can do that, but you should still apply for Medicare when you're eligible. It's the same application. You just suspend your cash benefits from Social Security, but you want your Medicare, at least your Part A, because then it makes getting Part B easier and the drug plan easier because you're already in the system. Part A has no premium. Part A is hospital insurance, which I'm going to go over in a moment. There's no premium for that because you pay for that throughout your working life. The FICA tax that comes out of your paycheck, that is your Medicare hospital insurance trust fund tax. And if you're working and you have more than 40 quarters of coverage, which is the minimum number of work you have to have for Social Security or other benefits, then you get premium-free hospital insurance. Most people are eligible for that. If people on this call have been working and are in the union for 10 years or more, it's kind of a moot point. If you're not sure, you can contact Social Security or go online for a benefit estimate, and they will tell you how many quarters of coverage you have towards that 40, which is basically 10 years of work. 4 quarters in a year. So that's important. You want to make sure you get your Medicare when you're eligible. Now, I mentioned the hospital insurance part of Medicare, which is premium free. This covers you if you are an inpatient in a hospital or a skilled nursing facility. And a skilled nursing facility is defined in plain English, a rehab hospital for a condition that you were treated in the hospital. If you're in the hospital for 3 consecutive days, not counting day of discharge, and you have to go to a rehab facility, your Medicare hospital insurance will cover that. And it's covered in full for the first 20 days. After that, there's a copayment, and this year it's $200 a day from day 21 to 100. After 100 days, the coverage ends. Right? With a hospital stay, Medicare covers it in full, but there's a $1,600 deductible per spell of illness, which is called, in technical terms, a benefit period. You could have more than 1 or 2 hospital deductibles in a year, and at $1,600, that could start to cost real money. Right? And Medicare covers you in full for the first 60 days after the deductible is met. And then if you have an extended stay, Medicare still covers you, but then you've got a daily copayment. And I don't want to get into the weeds, but an extended stay past 60 days can wind up being very expensive. And I'm going to talk in a little while about how do we fill in those gaps. And there are a few ways of doing that. We'll talk about that in a minute. I just want to go over the basic program. Right? Now, Medicare Part B is your medical insurance. That covers you for outpatient surgery, doctor visits, in or out of the hospital. If the doctor bills separately, Medicare medical insurance will cover that. Durable medical equipment, lab tests, outpatient procedures, that's all covered under your medical insurance. Medical insurance does have a $226 annual deductible. Once you meet that deductible, Medicare kicks in and pays 80% of all of your medical insurance services. And it's 80% based on a fee schedule. The doctors just can't charge you whatever they want. They have a fee schedule that Medicare bases its payment on. If the doctor accepts assignment, then Medicare will pay the full 80%. You're responsible for 20%. If the doctor doesn't accept assignment, and most do, he can bill you up front and Medicare will reimburse you 80%. And he's limited to how much he can charge based on the Medicare fee schedule. All right. So in New York State, most services have a 5% cap. So they can only charge 5% more than what Medicare allows. And if it's for certain office visits or out of New York, it's 15%. New York has very good consumer protections. So an example, if the Medicare approved charge is $100, Medicare will pay $80 and you're responsible for 20. If the doctor doesn't accept assignment, he can bill up to $105. Medicare still pays the $80 because that's 80% of the approved charge. You would be responsible in this case for $25. But most claims in New York are assigned claims, which means the doctor agrees to accept Medicare's approved charges payment in full, and they will then pay him 80%. And that goes the same with outpatient services, a hospital surgery outpatient, equipment, lab tests, and Medicare pays 80%. You're responsible for 20%. Now I want to skip to Medicare prescription coverage, which is Part D. We'll get to Part C in a little while, but I want to just go over the Medicare prescription coverage. Medicare does have 19 drug plans in New York State. These are administered by individual insurance companies, Silver Scripts, which is Aetna, AARP, which is United Healthcare, Humana, Health First. There are a number of different companies. Some offer more than one specific product. We can help you pick the plan that works best for you. That's why there's no one size fits all. The premiums go from $10.90 a month to $116 a month. $116 a month may not give you better coverage. Right? Depends on the drugs you take. We can help you based on the specific drugs you take and your pharmacy to find which plan would cover your drugs the best for the least cost. So we can help you with that. But these are the drug plans. Many of them have a deductible, right, which cannot be more than $505 for drugs, separate from the hospital and medical deductible. Right? If you're taking inexpensive generic drugs, right, most plans waive that $505 deductible and start covering you from day one. And by inexpensive generics, I'll give you some examples. Some blood pressure medicines, right? High cholesterol medicines like Lipitor and the statins. If they're generic, they're usually very inexpensive, and the plan does not charge you that deductible. So let's say you're taking atorvastatin, which is the generic Lipitor, and a blood pressure drug, losartan. I'm just throwing those out. You're going to pay very little for those. Those are inexpensive generics. They've been around for quite some time. So you won't have your deductible, and you only pay a few dollars per prescription. Some drug plans also cover certain vaccines. The shingles vaccine is not covered by Medicare Part A or B. You go to the pharmacy and you get it a lot of the Medicare drug plans will cover a good portion of that. And that stuff's expensive. But if you have a drug plan that covers it, and again, we can help find out if the plan you're looking for covers that. Right, Shingrix is an example of a shingles medicine. We can help you find out if that drug is covered and how much you would pay. And we would get a pretty good estimate because the plans give us the information of what they charge for the specific drugs. You go to a doctor for that vaccine, Medicare is not going to cover that because it's not a prescription at a pharmacy, but your pharmacy plan might cover that. So Part A is hospital, Part B is medical, Part D is drug. And again, if you have a drug plan from your employer, it works the same as Medicare, hospital, and medical insurance. So you may not want to take a plan then. You would take a plan when your employment ends or your coverage ends, whichever comes first. And if you, I don't know if anybody on this call is on Medicare, but once you sign up for Medicare, you get this book. It's Medicare and You. This year it's 2023. It's about 130 pages. And it has in the back all of the plans for your area. Now, it may just be downstate New York, which is Long Island, New York City, Westchester, maybe Rockland. And if you live in that area, it'll have the plans that service your area. The state plans are the same everywhere in New York. Right? The Medigap plans are not listed in there except for a general description of the benefits. And I'm going to talk about that in a few minutes. But if you want what's called Medicare Advantage, or also known as Medicare Part C, the plans are in there. It's a brief description. If you call our office in Nassau County, we could send you a summary of all the plans in the county, their costs, and a brief description of their benefits. If they cover vision, dental, hearing, which Medicare doesn't cover. If they have a drug benefit, which most do. The only time I recommend a plan that doesn't cover drugs is if a person gets their drugs from the VA. Then you could get a plan without drug coverage. Doesn't make a difference on the cost, but some plans just cover the health benefit, not the prescription benefit. And we can help you figure out which plan covers your drugs the best and also might work best for you in terms of premiums and benefits. Now, Part C, you have to have A and B to get that. You have to have hospital and medical insurance for technical legal reasons, but you need A and B to get a Medicare Advantage plan. There are two types of Medicare Advantage plans. The first are HMOs, health maintenance organizations, which do offer additional benefits. They usually have a fixed copayment. So if you're going to your primary care physician, you know how much it's going to cost. Some of them have a zero copay for a primary care physician, but a higher copay for specialists. And each plan is different. So again, if someone says, what plan is good for me? We'd have to find out, you go to specialists often. Is your doctor in the network? Because with an HMO, you must use the providers in the plan network. Right? If you go out of the network, unless it's an emergency, your plan will not cover it. And Medicare will not cover it either, because once you sign up for an Advantage plan, you're saying, I agree to get all of my health care through the plan. Medicare is paying that plan every month, a lot of money, to provide and pay for your health services. So they're going to want you or require you to stay in the network with an HMO. And with most HMOs, you also need a referral from your primary care physician to see a specialist. Now, the second type of Medicare Advantage or Part C plan is called the Preferred Provider Organization, the PPO. PPOs are similar. They have lower premiums. You still pay the 160, excuse me, 164.90 that you always pay. There's a couple of plans that will reimburse you part of that. All right. But with the PPO, you can go out of the network and still have coverage, but your copay is going to be higher. If the in-network benefit is $0 for your primary care physician, out of network, maybe, excuse me, maybe $25. So it varies from plan to plan. Right? Specialists, there's a copayment there, and that can range from $25 or $40 in network, out of network, $60 to $75. So again, we'd have to look at the plan. What I tell people is, if you're considering a Medicare Advantage plan, check with your doctors to see if they take any of the Medicare plans in your area. This way you can make sure you're signing up for a plan that can work for you. And then we can find out, based on the drugs you take, which plan covers your drugs the best. So that's the two parts of that. Your doctor co-payments, what the hospital co-payments are, because they all have some kind of a range when you go to a hospital. All right. And if they offer vision, dental, hearing benefits. The summary sheet we have just indicates if they have that benefit, but we can go on to the plan web finder from the Medicare plan finder and find out what kind of vision or dental or hearing benefits they do offer. So we can help you with that. I mean, that Medicare website is medicare.gov. You certainly can go in there and check this information out. It might be easier if you call us and we can walk you through it. So those are the 4 types of Medicare benefits. Part A, hospital. Part B, medical, which has the $164.90 premium. Part C, which are Medicare Advantage. And Part D, Medicare drug plans. Now, a couple of things to remember also with the Medicare Advantage plan. You must live in the service area of the plan. So let's say you live in Nassau County, but you find a plan in New York City that offers more benefits. You can't sign up for that plan if your plan also, doesn't, if the New York City plan doesn't have a Nassau program. It's county specific. New York City is one area, but Nassau is a definite county. Suffolk is a specific county. Westchester is a specific county. So we can help walk you through this again. All right, but we would need the drugs you take, where do you live, your zip code, right? One thing I will tell you, when you see those commercials with Joe Namath or Jimmy Walker, ignore them. Because they're saying, give us your zip code and we'll tell you which plan can give you all these wonderful things. That's marketing. They represent the firm, not with one insurance company, but brokers who can sell you anything. So you want to be careful when you're dealing with someone who's trying to sell you something, because they will make a commission from that insurance plan if you sign up. So if you have an agent or broker you trust, fine. A lot of them are reputable people. But if you're not sure, call our office. I put our phone number in the chat. I put the New York City phone number in the chat also. So you can look that up, call them or call us, and we can help you find the best plan for you. Okay, now I haven't seen any questions in the chat. All right, I'm going to take a second to stop talking. And if you have any questions, this would be a good time. Unmute your mics. Is anybody awake?
Yes, Barry, we've been monitoring the chats. Nothing has come in throughout your presentation. So maybe, as you said, you had addressed all the questions during your presentation.
That's fine. That's fine. Now, a couple of other things. I mentioned everything goes through Social Security. right? Once you're on Medicare, they're out of the picture. But all applications and entitlement decisions go through them. So if you want, you can call Social Security's toll-free number. I'm putting it on the chat. Usually, you would, if you're calling them, put your phone on speaker because you're going to wait 45 minutes. So put your phone on speaker so you're not tethered to your desk. All right, but the number I just put up there, the 800 number, is for Social Security. You can apply on the phone. Usually what they'll tell you is, we're going to call you back on such and such a date. They'll make an appointment and they'll call you back. Or you can go to the office if you like. With an appointment, I don't recommend you walking in cold. Or you can do it online through the Social Security. It's SSA, Social Security Administration.gov. On the homepage, you're going to see a button that says Medicare. You click on that and follow the prompts. So that's relatively simple. Okay, so I hope I didn't go into the gross details because you would all be asleep. But I wanted to hit the highlights to let everybody know when they should apply, if you're working, when you can hold off, if you or your spouse is working and you're covered by them, if there is a retirement benefit from a union or an agency with the government, or a company that offers you a retirement benefit, you might want to just stay with that. Now, one thing I did promise to talk about is Medigap. Medigaps are supplement plans that you purchase as an individual to cover your Medicare cost share. Doesn't cover drugs, but if you remember, I talked about that 80-20 split or the hospital deductible. Medigap plans can cover that. All or part of it, depending on the plan. A couple of good things about Medigap is, unlike Medicare Advantage, there's no network. You can see any healthcare provider in the United States who is in the Medicare program. So if your doctor is in the Medicare program and Medicare will pay for their services, your Medigap plan can pay for their services too, all or part of your 20%. And there's no open enrollment season for Medigap like there is for the Medicare Advantage. If you're in a Medigap plan and you want to switch to a different plan, different company, or a different level of benefits, in New York State, you can do that any time of the year. And your new coverage will start the first day of the following month. The downside to the Medigap plans is they don't cover drugs like the Medicare Advantage, and they're more expensive than the Medicare Advantage as far as premiums. But they can, in the long run, actually be less expensive than the Advantage plans because those co-payment rates for inpatient stay, especially in a rehab hospital, where the Medigap plan can pay the whole thing, the Medicare Advantage plan, after 20 days, you're going to be on the hook for that $200 a day. So again, it all depends on your health and your financial situation. Medigap plans work for a lot of people, especially if they want to go to any hospital in the country. And I'll give you an example. Let's say you want to go to Sloan Kettering or the Hospital for Special Surgery in Manhattan, or the Mayo Clinic or the Cleveland Clinic. They're not in any Medicare Advantage plans from Nassau County. So if you went there, you would pay the full bill. With a Medigap plan, since Medicare covers that stay, then your Medigap plan will also cover it. As long as the provider is in the country, takes Medicare, even if they don't accept assignments, if Medicare pays for their services, Medigap will cover them anywhere. So these are things to consider. So when I said earlier, it depends on your health conditions and health status and your financial situation. It's absolutely true. So we can help you with a supplement plan, like a Medigap, a drug plan, or an Advantage plan, if that's the way you want to go. And again, there's pluses and minuses for each way. So when someone says, what's the best plan? You like chocolate or strawberry? Right? That's what I say. So we can help you with that, though. And if you're in New York City or one of the 5 boroughs of New York, you call the number I put on the chat for New York City, and they will help you also. Okay, so now I'm going to open it up again for questions because I covered most of my stuff. So please don't be shy.
Those who are saying the chat was disabled, the chat has been enabled. So if you would wish, you can type it in currently.
Right.
One question that did come up was, do you have a number for Rockland County?
That works out of the Rockland County Office for the Aging. Now, I'll tell you, if you get the Medicare New Book, which I just put down, yeah, in this book, on the back, there's a New York State number. You call that number, and it'll ask you what county do you live in, and they will forward you to the Rockland County SHIIP. They have a pretty good program up there. I used to know the folks there. So they have a pretty good program, and they can, again, do what I do. Right? I can put in the number for the New York State HICAP hotline, and they will then again refer you to any of the counties you want. Let me just, it's 800 701 0501, and that's for the New York State Office for the Aging HICAP program. They say, what's your county? And they'll forward your call right to that county HICAP program.
Thank you, Barry.
Okay. We have any other questions?
I don't see any other questions.
Remember, every county in New York State has a HICAP program. And if you look at around nationally, it's the SHIIP program, State Health Insurance Assistance Program, that Earl mentioned earlier. Every state has a program. They're all federally funded. They don't charge. They're not allowed to. And we can help you with all of these types of questions. Each state is going to have some different rules about certain things. Like I mentioned, the limiting charge in New York is 5% for most services. The national limiting charge is 15%. So some states may charge more. Some may charge some may have a lower threshold than others. They don't charge more. They allow the doctor to charge more.
Another question came up was, what's the number for Social Security?
All right, I put it on there, but I'll put it down there again. SSA 800-772-1213. Okay, I put that on the chat also. Can you all see it?
Yes, thank you.
Okay, yeah. Again, be prepared to wait a little while. They're good, but because of the volume of calls they get, they can get backed up.
Okay. Are there any more questions? I see all questions have been answered so far. Haven't seen any speakers mentioned. Okay, hold on one second. Hold on.
Okay. I can repeat the numbers verbally.
No. That may be helpful. I will. Let me Social Security number. I typed in the number for Social Security number. Do you see
Right.
that?
I just got that. And the number for New York State, refer you to any county, is this 800-701 number.
Barry, there's a question regarding, do you have a ballpark number for Advantage plans?
The Advantage plans, if I assume we're talking about the premium, many of them have a 0 premium, right? And they go up from there. Let me see if I have again, I can give you the downstate figures. And let's see. For the Advantage plans, let's see. I've seen 1 or 2 plans that go up to about $200. Those are PPOs who give you a lot of other benefits. The Advantage, but they're usually much lower than the Medigap plans. Because they're not standardized, we'd have to check for each county what they charge. But I'm looking here, Metro Plus in New York City, $142. In Hudson Valley, which is Rockland, there's a plan that's got 134. Many of them are zero. So I'm looking at a lot of zeros. I'm just going through for the range because the ballpark can be pretty big. So yeah, it goes from 0 to 140 something dollars.
Barry, I just want to confirm the number of Social Security is 772-1213.
Right.
Okay, the same number.
Mhm. Yeah. Now the drug plans, if you're just looking for a standalone plan, like I said, they go from $10.90 to $116. And again, based on everybody's individual needs, their prescriptions, right? We can work with you to find out what plan covers your drugs the best, including the premium. We'll come up with a bottom line number for the year. And that's how much you would be expected to pay for your drugs. And if you're taking those generics, usually the cost is lower because they don't have a deductible. So,
Are there any other questions?
Right.
Seeing none.
it's good that people are doing this, and I'm very happy that the union is doing these pre-retirement seminars because I get a lot of calls from people. I'm retiring this month. What do I have to do? Well, you waited too long is the first thing, because it takes Social Security about a month to process your application. So you'd want to, do as much advance time as possible. The initial enrollment period for Medicare is 3 months before the month of and 3 months after your month of entitlement, which is in most cases age 65. So if you are thinking of retiring and you think you're going to turn 65, you want to think about what do you need to do? Who do you need to contact? And again, contacting us is always a good place to start. Do I have anything else?
Not that I could see. Again, I want to thank you again, Barry.
Thank you for your time, everybody.
Thank you very much. Thank you everyone for attending. Again, if you have any questions, please call the office at 516-294-1338.